Hello, my name is Erin Areola and I will be discussing pancreatic cancer. So what is pancreatic cancer? So first, the image here is going to be a basic diagram of the body, and if you look on the right hand side, you see the liver, the stomach, and then the pancreas. So the pancreas is an organ in the abdomen that's just below the stomach, and it works to aid in our digestion as well as manage blood sugar. The tumors that can grow can be both cancerous and non-cancerous, so it is possible to have tumors that are not cancerous in the pancreas as well. And the most common types actually begin in the cells that line the ducts that carry digestive enzymes out of the pancreas. This particular type of cancer is called pancreatic exocrine cancer or pancreatic adenocarcinoma. So one thing that's particularly interesting about pancreatic cancer is that it is rarely detected in the early stages, and symptoms often aren't detected and don't begin until it's actually spread to other organs, so it can be kind of hard to treat. And that's also partially why older people generally are diagnosed with this cancer more frequently than younger people. So there can be a variety of symptoms for pancreatic cancer. I know that as we've been reading about different types of cancers through the course, we've kind of learned that there can be a really wide variety of symptoms with cancer in general. So a lot of things can be, it's hard to basically detect or know when to see a doctor because there's such a wide range of symptoms that could be related to cancer or could be related to something else. So some things include abdominal pain radiating to the back, loss of weight or appetite, jaundice, which is yellowing of the skin, fatigue, blood clots. One particularly notable symptom is new or existing diagnosis of diabetes that becomes more difficult to control, and this is because of the role that the pancreas plays in regulating blood sugar. So diabetes is definitely something that can be a particular cause or create situations where people are have pancreatic cancer develop. So these are some United States statistics. The graph here is going to demonstrate that there is a lot more cases of males having pancreatic cancer than females. If you take a look, it's clear that there's definitely more males being diagnosed with cancer. One theory is that this is due to increased use of tobacco and alcohol in men. Since these two things, as I'll discuss a little bit later, can be related to pancreatic cancer diagnosis. There were an estimated 48,220 deaths that will occur in 2021, and it is expected that the number of deaths from pancreatic cancer will continue to rise in years to come. And this does account for about 7.9% of all cancer deaths in the United States. And across the whole population, about 1.7%, so a little less than 2% of women and men will be diagnosed at some point in their life, and this is from data between 2016 to 2018. So with this cancer on the rise and all cancers on the rise, it can be assumed that there will be an increase in pancreatic cancer diagnosis. So this graph here is going to show for the United States the racial trends across both sexes, and you can see here that Black people are more likely to have pancreatic cancer, followed by white people, then Hispanic, then the Asian Pacific Islander and American Indian Alaskan Native. So those two groups actually have the lowest rates, with African Americans having the highest rates of cancer incidence. And this is partially due to lifestyle and increased risk of diabetes, but this is what we see generally in the US in relation to race and pancreatic cancer diagnosis. Globally, there's a little bit different of statistics as well. So the pancreatic cancer is the 7th leading cause of deaths worldwide, cancer deaths worldwide, and there is actually a higher rate in more developed countries, which I thought was interesting. There was a total of 432,242 deaths across the globe in 2018 from pancreatic cancer, accounting for about 4.5% of cancer deaths. The age standardized rate, so the rate per 100,000 people in Europe, was found to be the highest in 2018, with about 7.7 per 100,000 people. And then in North America, about 7.6. So almost the same, but those are the rates for the two highest countries with the highest incidence of pancreatic cancer. As I mentioned earlier, it is more common in men, and this is globally as well, not just in the United States. And I kind of mentioned as well that there is an increase in incidence and mortality in the last decade in both genders. So it's expected that we will continue to see a rise in pancreatic cancer in both genders as time continues, similar to other cancers that we have looked into in the course, where cancer is on the rise for several reasons among the population in the globe. So there are a few risk factors to having pancreatic cancer. The first one is going to be tobacco use. It's thought that about 25% of pancreatic cancers are caused by smoking, which is a pretty high rate. Throughout the course, we've read a lot about the impact that tobacco can have on different cancers, and that overall it's just so bad for your body and have so many negative effects and increased lung cancer incidence and everything like that. So pancreatic cancer as well. And some studies have shown that if smoking stops, then the risk can actually drop back down. So this is not totally irreversible, and if someone is a smoker, they can still decrease their risk by stopping smoking and making healthier choices. Overweight and obesity is also a risk factor for pancreatic cancer. It's found that you're 20% more likely to develop pancreatic cancer if you're overweight or obese. And this is actually associated with diabetes as well, since diabetes and obesity can be influential to one another, and both of these factors increase risk of pancreatic cancer. Another risk is chronic pancreatitis, which is inflammation of the pancreas. Sometimes this is seen in people who are frequent smokers or who regularly abuse alcohol. So if you have a chronic inflammation of your pancreas, it is more likely that you're going to develop pancreatic cancer, since your pancreas is undergoing stress through your lifetime from things such as alcohol and smoking. And then lastly, certain workplace chemicals in certain industries have an increased risk of pancreatic cancer due to exposure to certain chemicals, such as arsenic or chemicals used in the dry cleaning and metalworking industries. So these workers are more at risk for developing this cancer as well. I've touched on some of the disparities throughout the presentation. So men are definitely more likely than women, like I was saying, most likely due to having more frequent use of alcohol and tobacco, even across the globe. Age is also a big disparity. Most patients with pancreatic cancer are older. About 2/3 are at least 65, and the average age of diagnosis is actually a little over 70 years old. So partially because of the fact that the symptoms don't occur until later stages, and this is usually a late stage diagnosis cancer, so it's seen more frequently in older people. It's less likely that younger people would develop pancreatic cancer. African Americans are more likely to develop pancreatic cancer than whites, and this is also associated with diabetes or diet and exercise habits. And Asian Americans and Pacific Islanders actually have the lowest amounts, which I also mentioned and was visible in the graph previously. The differences in races can be associated to diet, alcohol, smoking, diabetes, and things like that. Socioeconomic factors can also have an impact. If someone doesn't have as much access to medical care, maybe they're not insured, the physical environment, their behavior, if they have access to treatment or preventative care, or if they're insured and are able to get screening, all of these things can cause disparities to lower income people who are unable to access the proper medical care that they may need to detect the early stages of pancreatic cancer and have a better chance of beating it or of seeking treatment before it spreads further. So usually pancreatic cancer is diagnosed in the late stages. For the reasons mentioned previously, it's usually spread to other organs when it's diagnosed because symptoms do not present themselves until then. And there are a few ways to diagnose the cancer. A doctor may order image tests such as an ultrasound, a CT scan, or an MRI. That way they can take a look and see if there's a pancreatic tumor or if there's any growth. A biopsy can be done to test tissue samples to see if the tumor is benign or if it needs to be removed. And they can also conduct blood tests for specific proteins to tell if pancreatic cancer is present. And the image here shows a pancreatic tumor within the pancreas there on the left, and that is what the growth would look like. So for treatment of pancreatic cancer, surgery can be conducted to remove tumors, depending on the type of tumor and where it's at, and if surgery is considered to be a safe option. Patients can also undergo radiation and chemotherapy or a combination of the therapies. They may need surgery to remove a tumor and then to also still undergo chemotherapy, just depending on the cancer and how far along it is, where it's located, and the individual person. If the cancer has gone too far and there is not hope of treating the cancer and it's in the later stages, doctors may just provide palliative care and symptom relief to make the patient the most comfortable. And sometimes patients seek alternative medicine just to be able to cope with the distress from having cancer. So acupuncture, meditation, yoga, exercise, therapy, all of these things may be utilized by patients to cope with the distress of having the pancreatic cancer in general, to make their life more comfortable and make their mental health better in dealing with their treatment. So to prevent pancreatic cancer, there are some links to family history that you can't really prevent those things. It's always great to know your family history so you can know if you're more at risk for certain diseases or cancers, and you can try to access screening and really be aware of, as you age, the different ways you might be able to prevent late stage diagnosis. But stopping smoking really decreases the risk of pancreatic cancer, since, as I stated earlier, this is something that plays such a large role in the diagnosis. Limiting alcohol also, alcohol has many negative health effects on the body, so it does increase the risk of pancreatic cancer as well. And having healthy lifestyle choices, such as a healthy diet full of vegetables and leafy greens and proteins, and exercise. And these things can help prevent diabetes, which also reduces the risk of pancreatic cancer. So just trying to live a healthy life. And then these are my references. Thank you.